15-minute podcast by Dr. Trescott. She's a very well-known pain physician, and you can just email it to someone and just tell them, look, on your way home, don't listen to the radio, just press play on this, and it's a physician talking about genetics and how it applies to pain management, and it makes a lot of sense. There's a link for AI biotech sales and marketing, and articles and literature. I was just showing Dr. Sue. We put two that there's a lot of publications from CERC and New England Journal of Medicine, things like that, because there are physicians that are out there that are going to want to see, use what's called evidence-based medicine, and they want to see the publication. So there's a big article right here from Mayo. It's a 3,500 patient study about using genetics to lower hospitalization on patients going on warfarin. There's a CERC article in there that talks about the AHA and their stance on it. There's a bunch of information on Plavix, etc. And there's test questions that, after you read 1 and 2, you can get, there's some test questions that you need to know. And this is really cool. This is the actual FDA website. And most people don't realize how many drugs have boxed warning labels based off of genetics. I'll just scroll down. It's over 100. Okay, and physicians are prescribing all these medications daily. Okay, so based off of we'll just pick diazepam. It's a psych drug. Okay, it goes through a particular pathway, and there's drug-to-drug interaction. So this actually, the tests that we do when you present this to the physicians. Hi, I'm Ed.
Hi.
Hey, you want to help them practice better medicine and make their lives easy, okay? So there's all this information here for you at your fingertips. So please use it as a resource for you. If a doctor asks you a question you don't have the answer to, you can try to find it in here, or ask one of the residents to help you get the information that you need. Okay, so one thing, there's a doctor out of Scripps. There's several physician or teaching institutions that use this as standard of care on their patients, and Scripps is one of them. And Dr. Eric Topol is out of Scripps in San Diego, and he's extremely well known, and he's one of the leaders in the U.S. on genetics. Okay, this is a study he did on 475 patients. What he looked at is the social impact of this. Okay, so out of the 470 patients that he tested, 41% of the patients were at high risk based off of their genetic, and 434 were low risk. And that's a good number. So 10% of the patients were at high risk due to genetic implications. Of course, the high-risk patients didn't think the test was as important, because that's just the way the high-risk patients are. The doctors will probably nod to that. But nonetheless, 70% of the patients thought that results were useful, and 80 to 90% of them understood it. Okay. 13 to 14% of the patients, roughly 14% of the patients, were concerned about their privacy, but there's a thing called the GENE Act. It's a Gene Information Act that basically says that your genetics can't be used against you by an employer.